I'll give you a demo, but I would typically get people to stand up on the bed with their heel lift up with a little bend in the knee. Okay, so you can do it on the floor as well, but generally in the clinic or if you've got a bed, it's a lot easier to do it standing up on something. So I'll get you to stand up and then pop your heel on whatever knee you want to be taped. No, just this one? Yep. I just want a little bend. Which side do you want? That side. Cool. Righto. So knee taping wise, we're going to show you just a typical like knee stability tape. So if someone's had, like if you've heard of an MCL injury or LCL, so lateral ligament injury, this is what you typically do if they're coming back to sport. Now, you don't have to do both sides. So you don't have to do both in and outside. If someone's just had an MCL injury, you might just want to do the inside. Vice versa, if it's an LCL injury, you might just do the outside. So what we'll do tonight is I'll just show you the MCL and then you just apply the same principle to taping the same thing on the outside, okay? I would typically use Fix-A-Mole underneath. So this is just a bit more of a skin protector as our anchor. So you're going to do a loop around the thigh. Again, it's really loose. Fix-A-Mole can be fickle. If anyone's played around with it before, it'll knot up on you. I tend to find folding it and giving it a bit of a crunch makes it easier to stick on. So pulling this off here, I'll get my patient player to have a little bend in their knee, and then that also means that their muscles are a bit tensed as well. So just sticking the tape on there like that. Sorry, Caitlin, I'm just going to come around here. It doesn't have to be pretty, this under tape, because we're going to go over it. Sorry, there we go. And then the last bit just coming in there. All right. So that will be the underlayer. Stick it on. We're going to do the same thing. If you feel around their shin, there's like a knobby bit of bone under their knee. That's what we want this bottom bit to go under, okay? So same thing, going around like so. Cut it up, and we'll stick it on from there. All right. Okay. And sticking that on there. So that's our underlayer. Now, you've got two options, and this is all on the videos and that, so I'm just giving you a few different options. You can do it again with the rigid over the top, or you can just go straight into sticking on our supports for our medial or lateral ligaments, okay? So I'm just going to go straight into putting the supports on. This way I would come around this side of the player, so everyone wants to come in and just so they can see what I'm up to. Okay, I'll get you to bring this foot back now. Are you okay? Yep, good. All right, so you right there?
Really test
you can pop your...
You're
right there. I know, I've got you. Kelly's like, you're right. So we're going to do like a crisscross over the side of the knee. So your MCL sits in here, so connecting the thigh bone to your shin bone. You're going to start at the back, bring the tape around so it crosses where that ligament is, and stopping there. And then you're going to do the same thing front to backwards, a nice crisscross. And we'll do that twice. Like that. And again, going from there and across. Like that. And then again, front to back, like so. So after we've done that, you'll know you've got your stretch EAB or your blood tape. Actually, Han, could you grab me a bit of blood tape? Thank you. Thank you. All right. So going over the top with some overwrap, just to keep it all sticking on. So once you get to this point, you're just following the line of the tape that you've already put on, okay? So this is just you sticking on extra supports around there, and then as you come back up, You're going to follow the line of the brown rigid tape and come back on there. All right, a little bit of brown to stick it down. And that's what a medial knee would look like, okay? So you can do the exact same thing on the outside, and if you want, you can go the whole kit and caboodle. But really, if you've got a medial injury, you only need to do inside. Same thing, lateral, you only need to do outside. Questions?
So say you've got a kid in the footy club that says, oh, my knee's not too good. And
Yep.
And they don't know whether it's medial or medial or lateral.
Yep.
So
I would go if they have pain here, tape here. If they've got pain on the outside, tape the outside. Yep. And we're going to show some front of the knee tapings in the next little bit. Yep. Anyone else?
do you not say go and see a physio?
I would typically say that. I mean, I'm already there, but yeah, typically you want to know what you're working with before you start taping it. But if you're in the middle of a game and they go, oh, my knee's sore on the inside, you could try something like that. Yeah. Alrighty, let's have a go. For those who want to get their knees out, that'd be great. Grab some blood tape and some Fix-A-Mole and we'll rotate the scissors, alrighty?